So I think the best example I have is if somebody has a stroke, for example. They were able to cook for themselves and drive around and go grocery shopping and bathe themselves and dress themselves and go to the bathroom and walk around their house, garden in their backyard if they wanted to, and they have a stroke and all of a sudden they can't do those things anymore. Everything becomes very hard. That's where we come in as OTs and OTAs. We work to help people to get to be able to do the things that they want to and need to do. So for them, they might not be able to go to the bathroom anymore. They might not be able to take a shower or dress themselves, and that's very frustrating. I don't know if anyone's ever had an illness, injury, or disability where they couldn't do those things anymore. So OTs come in and we help them to be able to learn those things again so they can live their life as independently, as functional, as full as possible, just almost as if they didn't have that stroke. I think about OTA is that it is a hidden gem of a profession, and I really wish more people knew about it. I think a lot of people want to go into healthcare because they want to help people, and that's a wonderful thing. I think some of the other professions, such as maybe nursing or respiratory therapy or EMS, those are wonderful professions, and we need everybody for that. But what I really like about OTA is that you don't have to work the weekends unless you want to. You don't ever have to do an overnight because your patients are sleeping, and you don't have to really work the holidays unless you want to either. So it's a very basic 8 to 4, 9 to 5 type of job. There's lots of quality of life. You can, go home early and spend time with your family and loved ones and things like that, but you're really making a difference in people's lives, and that's what's really important, is that, it's really frustrating to have an illness, injury, or disability and not be able to do the things that you could before, or if you were born with a disability and you just never were, able to do certain things that other people could do, just helping them to be able to do those things so they could be happy and live a meaningful life.
Some of the job opportunities for occupational therapy assistants in this area would include working in clinical settings, like in, for example, a Tidal Health or an Encompass Rehabilitation Hospital. Also, though, in skilled nursing facilities, in working with some people who are elderly, and also in the school systems. There are a number of occupational therapy assistant practitioners who are working in school systems, working with pediatric clients or kids in the school systems. Beyond that, occupational therapy assistants can work in administrative positions having to do with director of rehabilitation. I know one of the graduates from Warwick Community College is now director of rehabilitation in a local skilled nursing facility. So there's a lot of opportunity for occupational therapy assistants in the area. The starting salary, as I'm understanding it, a starting salary locally is about $30 an hour. Nationally, the average is about $60,000 a year. However, if somebody is ascending to a more administrative level, like a director of rehabilitation, that certainly is going to affect probably an increase in their annual salary.
Oh, so today we had a really fun class. We had an activity analysis presentation. So the students have been learning all semester long how to analyze an activity. So today they presented for 15 minutes each, and actually this is a bracelet that we made today. So one of the activities, we beaded bracelets. We made friendship bracelets out of yarn. We made slime. We potted flowers. I have taken the class and we've gone outside and played soccer, played frisbee, and played badminton. And then, of course, we've just done things like cooking activities. We've made galaxy jars, which is really fun. So it's a very hands-on curriculum. It's a very hands-on profession. You're not going to be sitting in an office. Every day is going to look really different. You're going to come in and you're going to see different patients, or you might follow that patient. And that's a beautiful thing, too, because you're seeing them when they just had their stroke, and then 3 months later, you're still seeing them and they're so much better. So it's a very hands-on profession.